Hello, my name is Heather Burnley, and for this video I will be doing oral cares. So I've already gathered my materials, and I guess there was supposed to be a waterproof pad in here, but there is no longer one in here, so I'm just going to pretend. So now I'm going to go in with my patient. Knock, knock. Hi, Jane. How are you today? Great. Well, my name's Heather Burnley, and I'm going to be your nurse for today. So I've got some oral cares here for you. So we're just going to go ahead and brush your teeth. All right? So I'm going to go ahead and use my hand hygiene. Make sure my work surface is all clean. And put on some gloves. Okay, Jane. So Jane is unconscious. Jane. So in order to do your oral cares, what we're going to do is I'm going to scoot you over to your left side, or to the left, and then I'm going to roll you onto your right side. And I'm going to angle your head a little bit down so that way as I'm brushing, all of the contents in your mouth will drain out of your mouth, okay? And I'll have a waterproof pad below you and a basin to catch anything that might fall, okay? So I'm going to go ahead and raise the bed now. And then we're going to go ahead and lay you flat. So Jane, I'm just going to go ahead and check your name and date of birth on your bracelet here. Okay, and now we're going to go ahead and get you positioned, all right? So we're going to scoot you over to the left now, okay? 1, 2, 3. All right, and now we're going to roll you onto your right side. So on the count of 3, okay? 1, 2, 3. All right. Okay, here you go, Jane. Just gonna bend your legs here. Here we go. All right. So now, Jane, I'm just gonna go ahead and put all the pads underneath you that I'll need. This is my pretend waterproof pad here. And then my little washcloth. I have a syringe full of water here with my cup. Okay. Place my basin underneath her. Okay. And before I begin, I'm just going to go ahead and examine her mouth with a tongue blade and a pen light. So Jane, the first thing I'm going to do is I'm just going to go ahead and look in your mouth. So I'm going to stick a tongue blade in it just to move your tongue around so I can look for any kind of ulcers or anything, okay? So here it is, I'm sticking it in. Check out by her teeth, under her tongue. And if I needed to, I would use a gauze to manipulate her tongue. And now we're going to go ahead and begin brushing her teeth. So, Jane, I'm going to stick the toothbrush in your mouth now, okay? So here we go. Okay, just making sure to brush all surfaces here. Brush gently on her tongue. Okay, I'm going to rinse out. So Jane, now I'm going to go ahead and rinse out the contents of your mouth, okay? So make sure to rinse it all very well. Okay. And for any remaining, I'd use a tooth tap, or we could use the suction unit. Okay, all dry. Jean, I'm just gonna wipe your mouth off now, okay? And now I'm just gonna put some little petroleum jelly on your lips here, just to keep them nice and moist here. All right. Okay, Jean, we're all done now. Scoot this over. Okay. Change gloves, hand hygiene. All right, Jean, now we're just gonna go ahead and roll you back onto your back. And then we're gonna scoot you back over, okay? All right, so we would have a lifter pad here. All right, here we go. 1, 2, 3. There we go. Okay, lift the head of the bed up. Make sure she has her call light. Okay, I'm gonna straighten your legs out here. Here we go, Jane, just scooting up your gown here. All right. I'm gonna lower the bed. The lowest position. She's got her call light. She take off my gloves, hand hygiene, and then clean up my work area.